Good morning, friends. Welcome to all of you. So, in this today's lecture, we'll continue with remaining diseases, and in that, we're going to study diphtheria. So, in previous lecture, we have seen Mycobacterium tuberculosis as well as uh, other diseases. So, we'll continue with diphtheria. So, diphtheria is caused by only toxigenic strains of Corynebacterium diphtheria. Okay, so there are strains, two types of strains, that is toxigenic as well as non-toxigenic in bacterium Corynebacterium diphtheria. Okay, so Corynebacterium diphtheria has two strains that is toxigenic as well as non-toxigenic, and the diphtheria is basically caused only by toxigenic strains of Corynebacterium diphtheria. So rarely a diphtheria like illness is caused by toxigenic strains of Corynebacterium ulcerans, then Corynebacterium pseudotuberculosis, and Corynebacterium diphtheria has three biotypes, that is gravis, intermedius, and mitis. Okay, so the gravis biotype is associated with most severe diseases, but in any strain may be toxigenic. So all clinical isolates of Corynebacterium diphtheria should be tested for its toxigenicity. So non-toxigenic strains can cause sore throat and other invasive infections and are associated with endocarditis. Okay, so these are overall background behind diphtheria, the causative agents, and their clinical symptoms. Okay, so illness. So as far as illness is concerned, so classic diphtheria is an upper respiratory tract infection characterized by sore throat, then low-grade fever, and an adherent pseudomembrane of tonsils, and it is known as tonsillitis, then pharynx and or nose. So what are the symptoms of diphtheria? So basically it is infection of upper respiratory tract, and its main symptom is sore throat, then low-grade fever, and an adherent of pseudomembrane of tonsils, then pharynx and nose. So this disease can involve almost any mucous membrane. Okay, so this disease can involve almost any mucous membrane. You know, mucous membrane is the lining that covers respiratory as well as digestive tract. So for clinical purposes, diphtheria can be classified according to site of infection. So there are different sites in your body that can be infected by diphtheria bacillus. First, that is anterior nasal diphtheria. So anterior nasal diphtheria is usually present with mucopurulent discharge from nose that may be bloody and white pseudomembrane on nasal septum. So particularly this anterior nasal diphtheria, it is related to nose and nose related organ system, and it causes mucopurulent discharge from nose. Sometimes that discharge contains blood and white pseudomembrane in nasal septum. Then next, pharyngeal tonsillar diphtheria. So basically this diphtheral infection is related to pharyngeal part as well as tonsils. So pharyngeal and tonsillar diphtheria, the most common type of infection, initially present with malaise, then sore throat, then anorexia, then low-grade fever. So these are symptoms associated with pharyngeal and tonsillar diphtheria. So within few days, a bluish-white pseudomembrane forms, and on one or both tonsils that can extend to the tonsillar pillars, vulva, soft pellets, pharynx and nasopharynx. Over the time, the pseudomembrane involves assuming dirty grey color with areas of green or black necrosis surrounded by minimal amount of erythema. So attempts to remove the pseudomembrane causes bleeding. With severe disease, patients can develop edema of anterior neck. If significant amount of toxin is absorbed into bloodstream, patient may develop pallor, rapid pulse, coma and death. So basically this bacteria secretes toxin, and that toxin, if enter into the blood, it causes severe symptoms or illnesses. The different differential diagnosis of diphtheria includes streptococcal pharyngitis, then viral pharyngitis, then visceral angina, then infectious mononucleosis, then oral syphilis and candidiasis. Okay. Then next is laryngeal diphtheria. So if the infection involves larynx, it is a part of respiratory tract. So larynx, it is also known as white box. It may occur either as an extension of pharyngeal forms or as a laryngeal involvement alone. So patients can present with fever, hoarseness, then breaking cough, then pseudomembrane can cause potentially fatal airway obstruction. Okay. The next is cutaneous diphtheria. So, as the name suggests, so this diphtheria is related to cutaneous layer. So, cutaneous diphtheria caused by either toxigenic or non-toxigenic strains of Corynebacterium diphtheriae, and it is usually mild, typically consisting of non-destructive sores or shallow ulcers, and rarely causes toxic complications. So, this disease may present as a scaling rash or as a clearly demarcated ulcers, and a chronic skin lesion may harbor Corynebacterium diphtheriae along with other microorganisms. So, skin infection with Corynebacterium diphtheriae are common in tropical climates, and this is likely to be the reason for high levels of natural immunity along local populations in these regions. Okay. So, reservoir. So, what are the reservoirs for these particular diseases? So, infected humans are the main reservoirs. So, person who are infected with Corynebacterium diphtheriae, it harbors that bacteria, and it may transfer that bacteria from one person to another person or through other modes or means. So, modes of transmission. So, diphtheria is transmitted from one person to person through respiratory droplets, or less commonly through contact with discharge from skin lesions, and historically raw milk and fomites were known to be served as vehicles. Okay, so basically this disease is transferred from person to person, and as raw milk also contains diphtheria bacillus. Okay. If you see the incubation period for this disease, it usually takes 2 to 5 days, and it may extend up to 1 to 10 days. Okay, so this is an incubation period for this Corynebacterium diphtheria. Then communicability. So persons are communicable up to 4 days after treatment with effective antibiotics has been initiated. So untreated persons generally shed bacteria from respiratory tract or from skin lesions for 2 to 4 weeks after infection. So a chronic carrier state is rare but known to exist, and such a carrier may be shed microorganisms for 6 months or more. Then next, prevention and control. So how to prevent these particular diseases? So adequate heat treatment of milk. Okay, so boiling or pasteurization of milk is very important as far as all these diseases are concerned. So infected person should not be allowed to handle milk and milk related products. So the person who is already infected with Corynebacterium diphtheria, that person should avoid handling of milk and milking process or milk related products. Unhygienic practices like sneezing and coughing by dairy person should be avoided. So the sneezing and coughing may introduce this bacteria into milk and milk related products. Then proper vaccination of individuals against diseases is an efficient prophylactic measure. So there is vaccine called diphtheria vaccines, and that vaccination should be regularly done. Okay. The next important disease is Q fever. Okay, so this is again the important milk-borne disease, and it leads to manifestation of death if it is in very severe condition. So Q fever is caused by Coxiella burnetii. So raw milk is commonly implicated as a vehicle for transmission of disease. So basically the Q fever causing bacteria, that is Coxiella burnetii, it is mostly present in raw milk. So Coxiella burnetii is more heat resistant than Mycobacterium tuberculosis. So this is a heat resistance bacterium. Okay, so it can survive after pasteurization, and if specified temperature is not maintained, also freezing temperatures. Okay, so these corynebacterium Q fever causing bacteria, that is Coxiella burnetii, it still can survive after pasteurization. So it is heat resistant bacteria, so even at low temperature it not get killed. So in the view of considerable heat resistance to these microbes and the time temperature combination used in pasteurization is selected on the basis of heat inactivation of this microorganism. So main aim of pasteurization of milk is to reduce Q fever causing bacteria. So pasteurization process is mostly the main target for pasteurization is removal of Q fever causing bacteria, that is Coxiella burnetii. So it has been found to be viable for 2 years at 20 degrees Celsius, and range is 0.5% formalin and 1% phenol. So it has also been observed to remain viable for 25 days in rennet cheese and 42 days in cottage cheese, whereas in yogurt it is killed within 24 hours due to its acidity. So all these features make Coxiella burnetii a microorganism of great public health significance for its pathogenic potential. Okay. So individuals who have frequent direct contact with animals, including veterinarians, then meat workers and sheep and dairy farmers, are at high risk of Q fever. So Q fever is rarely fatal. So most patients get Q fever by coming in contact with infected animals that are previously infected with Q fever bacteria, then their tissues and their fluids. Okay, so these bacteria mostly present in animals in their infected parts like infected tissues and their fluids. So transmission may occur through breathing of contaminated air or dust from an area with large concentration of the animals. So tissue from animals giving birth pose particular risk. So people can also become infected indirectly from animals through contaminated materials like wool, straw and fertilizer. So there is a risk of Q fever from consumption of contaminated raw milk, then sheep, then cattle, goats, cats, dog, and some wild animals like bobcats, then rodents, birds, then ticks. They all carry this Q fever causing bacteria. So most infected animals do not show signs of illness, but Q fever may sometimes cause abortion. Okay. So only about one half of all people infected with Coxiella burnetii show signs of illness. Okay, so there are most of the people still after infection they do not show any kind of signs and symptoms, but they still harbor that bacteria. So for patients who become ill, the first symptom of Q fever is resemble to flu, and it may include fever, chills, sweats, headache and weakness. So these are the symptoms associated with Q fever, and these includes fever, then chills, then sweating, headache and weakness. So Q fever may rarely progress to affected liver, nervous system and heart valves. So Q fever is diagnosed by identifying bacteria in tissues or through blood test, and that detects antibody to microorganisms. Patients with mild transient illness usually do not require treatment. So placenta on other birds' products and aborted fetus should be disposed of immediately and seek veterinary assistance if animals have reproductive and other health problems. Then sources. So mostly the human infection is by inhalation of infected dust of fecal matter. Infected cattle continue to excrete the microorganisms in its milk for longer time. So these are main sources for Q fever causing bacteria. Okay, and mostly symptoms, if you consider symptoms regarding these diseases, then these are high fever, headache, then weakness, then malaise, severe sweating and virus like pneumonia. Then prevention and control. So how to prevent this Q fever? So adequate heating of milk and cream then calving sheds should be away from milking sheds and dairy. Then animals should be properly vaccinated. It is one of the important factor in this particular disease control. Then survey for determining the prevalence of infection in area should be carried out. Okay, so these are basic details regarding Q fever bacteria, Q fever disease. So next we're going to see viral infection. So viruses are again important agents. They form in milk and they causes various types of illnesses and diseases. So the rapid growth of frozen and convenience food has given to increased concern about the possible role of such foods in dissemination of viral infection. So although food is rarely reported a vehicle for viral distribution, a few breakthroughs of poliomyelitis have been tracked to raw milk. Okay. So personal contact with mechanical distribution by flies are believed to be the usual routes of infection with enteric viruses. Then outbreaks of infectious hepatitis have occurred in which food appear to be the most probable means of transmission. So there are several diseases like hepatitis and others. They are caused by through milk. Epidemiological survey evidences suggests that ingestion of raw carbs or oysters taken from sewage polluted waters could be a mean by which infectious hepatitis is spread. So a number of factors can influence the importance of any food as a vehicle for spread of viruses. Among these are opportunities for contamination with infectious viruses and ability of virus to survive and remain infectious under conditions of handling and storage. The extent of absorption of food and effect of ingredients like flavoring and preservations and consumption from other contaminants. However, unlike bacteria, viruses will not multiply in foods. So they will either survive at a constant level or die out. So since some frozen foods are subject to great deal of handling in manufacture and kept frozen and require little or no cooking in the home, so they would appear to be likely source of viral distribution and should they become contaminated during preparation. Then next, enterovirus. So these are a group of viruses that can cause severe epidemics of diarrhea in infants and children on ingestion of contaminated milk. Among these most common human pathogens are polio and Coxsackie virus. So milk and its products are commonly contaminated with enteroviruses mainly through fecal contamination. Then unheated milk contaminated after pasteurization plays significant role in transmission of diseases. So especially in developing countries, however, polio virus can be inactivated by milk pasteurization, and compared to polioviruses, Coxsackie viruses are more resistant to heat treatment. So basically polio and Coxsackie viruses are the main enteroviruses that may enter through milk. Okay, so poliomyelitis, other diarrheal diseases, poliomyelitis occur commonly. So after poliomyelitis is the main or routine infection that is caused by milk borne infection. So sources. So persons to person contact is the main mode of several viruses. So viruses mostly transferred through milk and through animals by person to person contact. So flies may also serve as a vector for spread of these diseases, and fecal contamination of water as well as milk is another source of contamination of viruses in the milk and milk related products. So there are some symptoms associated with viral diseases, and it includes first, there is a minor disease associated with viremia, that is infection caused by viruses, and it is characterized by gastrointestinal disturbance, then headache, fever, muscle stiffness and paralysis. So all these are associated with cell destruction in central nervous system. Then prevention and control. So how to prevent viral infections? So you have to carry proper pasteurization of milk. Then hygienic measures should be strictly followed to avoid fecal contamination. Then infected person should not be allowed to handle milk. Then immunization is also effective in preventing viral diseases, and proper vaccination of children confer protection against these diseases. So these are preventive measures for viral infection that may be caused by milk or milk related other milk-borne diseases. Then infectious hepatitis is another important viral disease that is mostly transferred or that is mostly caused by milk. So among the various viral diseases, infectious hepatitis is considered as one of the most serious viral diseases for which milk may be important vehicle for transmission. So mostly these diseases is caused by milk. So milk is one of the criteria for hepatitis. So illness is also known as hepatitis A and is caused by hepatitis A virus, whereas hepatitis B is not transmitted through milk. So again, this is important information that there are two types of hepatitis viruses, that is hepatitis A and hepatitis B. So hepatitis A is the only virus that can transfer or transmitted through milk. Okay. So what are the sources? So as far as sources are concerned, the disease spreading through person to person contact is handlers can be the important source. Then defective water supply in milk and plant may also introduce viruses. Then polluted environment in milk is play again very important role in contamination of milk. Then symptoms. So symptoms for this infectious hepatitis includes nausea, vomiting, lethargy, abdominal pain, then diarrhea, then fever, then chills, then anorexia, then lassitude, sore throat, bile in urine, and jaundice. So all these are the main symptoms associated with hepatitis that is mostly caused by milk. Then prevention and control. Proper sanitary conditions should be maintained during production and processing of milk. Yeah, it is again one of the important factor, not in case of this particular disease, but all diseases. So you should carry proper sanitary conditions, and infected persons should not be allowed to handle milk. So you frequently see in all this prevention and control that infected person, not in case of these diseases but other cases also, that infection persons should avoid all this process of milking and milk related processing. Then fecal contamination of water should be avoided, and adequate heat treatment of milk is likely to be inactive the viruses. So all these are prevention and some control measures that are usually used for controlling viral diseases regarding milk. Okay, so with this I declare that this particular milk-borne disease point is finished. So in next lecture we'll study another topic. Okay, thank you.